Welcome back to Beyond Boundaries, an Action Lab podcast. I'm Dr. Robert Hammerberg.
And I'm Dr. Kim Baker. Thank you for joining us for the final episode of our inaugural season. This is season 1, episode 5, and today we're focusing on a topic that impacts many of our listeners here in Texas, and that's rural health. In today's episode, for our Faculty in Action segment, we'll hear from Dr. Qian Xiao, an associate professor of epidemiology, whose research delves into the health impacts of sleep deficiency and circadian dysfunction. We'll also feature Abigail Grace during our Alumni in Action segment. An MPH graduate, Abigail currently serves as a research coordinator at UTHealth Houston School of Public Health in San Antonio.
And wrapping up our final episode, we'll hear from two amazing individuals with the Texas Department of State Health Services. Brandii Grant, a community health services program manager with DSHS Region 5-6 South, who is also an alumnus of our MPH program, and Savannah Walker, a dental hygienist with DSHS Region 910.
We're so excited to bring you these insightful discussions. We hope that they inspire you to think more about the unique challenges and opportunities in front of us within rural health. So let's get started. Okay, welcome back to the Beyond Boundaries Action Lab podcast. We're here with our Faculty in Action segment with Dr. Xiao, and she's going to share with us more about her research, her work in environmental injustice, and other issues that she cares deeply about. But as we start every episode this season, we have one main grounding question that we ask all of our guests, and that is, did public health choose you, or did you choose public health? Share with us how you got into the field of public health.
Sure, I love that question. I think it's a little bit of both. So I would say that I have a very non-linear trajectory. My PhD was not in public health. I was in a basic science program studying towards a degree in biological sciences at UC San Diego. I enjoy the science part of it, but I was never a big fan of killing animals. And, I understand it's important, don't get me wrong, but just personally, it wasn't something that I really enjoy. And I really couldn't see myself doing that for, the rest of my career. On top of that, I have always been thinking about ways where my research can have a little bit more direct impact to human populations. So after I completed my PhD, I decided to change my career path. So I went down to University of Michigan and did an MPH there in epidemiology. I think that's where I really fell in love with epidemiology. I have to say that I never thought that I would land an academic career, to be honest. Because I loved the more direct impact, I thought I would be enjoying the practice and, more practical side of things a little bit more. But I just found myself enjoying data analysis, statistics, finding patterns from data so much that I decided maybe I'll give it a try. So I applied and got into the cancer prevention fellowship at NCI, where I did my postdoc, and I kept feeling good about it. And I started to look for academic jobs, and here it is. So I think it's a little bit of both. I was trying to find my path, and then public health just appeared to be the right choice for me. So it worked.
That's great. And, a nonlinear path to public health is our most common path into public health from those that we've interviewed. Yeah, so you're not alone in that. You mentioned just vaguely your research. I'd love to learn a little bit more about how your academic path in, taking in epidemiology and your background in biological sciences kind of led you to focus on neighborhood and the built environment and environmental injustice in kind of like the urban rural landscape setting, because I feel like that's also nonlinear connected to not really very well connected to like epidemiology traditionally and stuff like that. So could you talk about that?
Sure. that took a little exploration and being all over the place as well. So when I first went to NCI, the first job for all the cancer prevention fellows there was to find a preceptor. So I first worked with, a preceptor for a year on gastric cancer and some other types of cancer, and then she left NCI, so I had to find another preceptor. So my second preceptor with whom I worked with 4 years, the vast majority of my postdoc there, is a physical activity person. So I really liked this program because it was very broad and impacted a lot of different cancer sites. I have never considered myself as an outcome side person, not focusing on a specific type of disease or cancer. I'm more of an exposure side person that I'm really interested in, the environment and behaviors that can impact disease risk. So I worked with my preceptor, and as I mentioned, he does physical activity, and I did some physical activity related projects, but towards the end of my postdoc, I started to think more about, how do I differentiate from my advisor, as many postdocs do. And one of the niche that we have found is that he studies physical activity and sedentary behavior. But how do we spend our 24 hours? There's a big chunk of time is missing, which is sleep. So I got interested in sleep and did some studies looking at, sleep patterns and cancer risk and mortality, various health outcomes. And then I started to get a little bit deeper in the fields and started to realize that the neighborhood environment also plays a big role in shaping sleep, both the socioeconomic disparity aspect of the neighborhood environment and light at night, which is the physical attribute, both of which do have an impact on sleep. So I think that's sort of my introduction to the environmental health. And I started to look at various ways of measuring socioeconomic disparities and light at night, and then realized the two are also connected because the neighborhoods that are poor also tend to be neighborhoods that have higher exposure burdens of light pollution, air pollution, many other things. And that's where I got introduced to the idea of environmental justice as well.
I'm just so fascinating. First, I just want to know more about the sleep connection, right? The sleep connection and the environmental injustice, right? You talked about different exposures to light and noise. I am also assuming pollution. And so in terms of any neighborhood differences, right? In terms of urban and rural, what have you seen? What do you know? Like, what can you share more about that?
Sure. So first, broadly, I think, as I mentioned, the poor neighborhoods, they tend to have higher levels of hazardous exposures to many things: light pollution, noise pollution, air pollution, extreme heat. However, that data usually comes from urban settings. So we don't really know. When you think about rural places, you don't think about them as places with a lot of light pollution or noise, or, so I think there is definitely a rural urban difference in terms of the disparity patterns. So that's actually one of the things that we did in a recent paper where we looked at the relationship between light pollution as measured by satellite data, and the social vulnerability index, as many of you, is something developed by the CDC. And we did our analysis stratified by rural urban status using the RUCA code by the USDA. So we looked at, there are 10 different categories from the most urban to the rural setting. And what we found there, interestingly, at the beginning, I was thinking maybe we'll just say the association in urban settings, especially metropolitan areas, and not so much for, small towns and rural areas. But what we found is actually much more complicated than that. We found that it's the core. So if you look at the 10 categories, for example, for metropolitan area, they will have more core areas, then they will have commuting areas, which is more suburbs. And then, it's like a bubble expanding to 3 layers. And they do those 3 layers for the metropolitan, micropolitan, and small towns. And then they have a rural as a 10th category. So that's how they classify that. what we found is that there is a really strong positive association between higher vulnerability and higher light pollution in the course of all three areas and in rural areas, which was really surprising to us. So there's definitely that relationship there. However, it's the suburbs that has weaker or even now association. So it seems it's less of a rural-urban difference. It's more of a, suburb versus core difference, which I guess is a novel finding in our study. And also another thing related to that is that the social vulnerability is not a singular measure. SVI has different components, and we did find there are differences depending on which component you look at within that vulnerability, instrument where they have different dimensions.
That's so very interesting. Thank you so much for sharing. I'm so curious to learn a little bit more about what you think some of the impacts or outcomes will be of that novel research in informing future public health interventions or future studies associated with health outcomes in those particular environments. Like what are some of the tangible outcomes of that research and applications?
Sure. I think one of the things that has always been on our mind is, can our research inform some policy making, right? If we all agree that light pollution or air pollution and other type of pollution is a problem, can we identify areas that A, has the highest exposure burdens, and B, are most vulnerable to the health impacts, negative health impacts of those burdens? And the second part, it's related to the first part because higher exposure burdens does usually lead to higher impacts, just the dose response. But it's also more than that because there's also the concept of vulnerability. So if you think about light pollution, especially the satellite-based measure, it's mostly outdoor light. And whether or not that outdoor light trespass into your bedroom will depend on many things, and whether or not that light pollution will actually have an impact on your sleep will also depend on other things. So in the past, in some of the epi papers that we published, we actually found that it's people in the poorer neighborhoods that has a steeper dose response. And we suspect it can be due to many things, such as lack of window treatment that can block the light, or they're already living in a crowded environment where the sleep hygiene is already suboptimal, or they have a lot of stressful events or work irregular hours, all of which can make them more vulnerable to the exposure to light compared to a person, living in a more affluent environment. So identifying places with higher exposure burden and higher vulnerability to the exposure burden is, at least to me, is critical for doing, data-informed intervention. So that's why we did the nationwide and very granular analysis, trying to identify the places. And of course, another part of that is to understand or quantify the contribution of light pollution and disparities in light pollution to health disparities. So really put some numbers on it, and then that can potentially motivate policymakers and activists to do something about it. So I would say those are the main, at least our objectives, and we can talk about that. And we are doing some, more hands-on work trying to positive impact.
So in line with that, what would you say on all the things you're looking at in terms of impact and what you can translate into policy, right? What do you think is the most exciting part of your work at this moment that you're looking forward to, that you're ready to dig in more, find more about?
Yeah, well, I think it's about the actions and impact. So one of the things, for example, we're working on, it's less of a research project, but I'm really excited about this, is a grant that we recently wrote and submitted to NASA in response to a call for environmental justice work. And for this grant, I'm collaborating with the Adler Planetarium in Chicago, and also a neighborhood called the Little Village in Chicago, which is a predominantly Mexican immigrant neighborhoods. And my partner at the Adler, they have had a history of doing after-school programs in that neighborhood with high school students to teach them about light pollution. So I met with some of their, staff members and people who are in charge of the program at a light pollution conference, and we talked about environmental justice, and we joined force to do this, collaborative project where we're going to expand, if we get the funding, of course, we're going to expand their program to be not just the after-school program, but really get into the high school curriculum as well. So we're collaborating with the high school teachers, and we're going to develop a dashboard that can serve as a tool. So we're going to add in some statistical analysis features for high school students, so they can use that in their science classes, and the satellite data that we gather to do some, hands-on science projects. And we're going to host some meetings. The students will play a big role in those conferences, inviting speakers, and the conference will be in their communities. So they will really be educating their parents, their younger peers, and other residents in the community regarding the problems with light pollution. Of course, we don't know if this will be funded, but I'm extremely excited about this collaboration.
We asked this question of all of our guests, and that question is centered around public health, right? And what brings you to your career and the work that you're doing. And simply put, we want to know, did you choose public health or did public health choose you? Tell us a little bit about your journey.
Yeah, of course. So for me, I think it's kind of interesting because I'm 2 years graduated from my MPH in epidemiology, and it kind of makes me laugh, especially looking at the position I'm in now, which is kind of like a research analyst, like database manager, kind of more in like the biostats, the epi side, is I never considered myself to be like a scientific person in any capacity. And so when I started my undergrad when I was 18, I loved like international cultures. And so I started in international studies, and I studied Spanish, I studied Mandarin. Like I was having just like a lot of fun going all over. And the way the degree was set up is they said, choose a geographic area. And I was like, I can't choose. And then there was this section called global health. And I was like, well, hey, that works. Like I can study every part of the world in the context of health. But I was like, that seems interesting, but I never actually studied health before. So I started taking like medical anthropology, and I thought, oh, I'm going to love this. It's kind of like literature, but like about people. And then I just kind of have to force my way through the stats and the biology and stuff. And I ended up liking that a lot more than I liked the medical anthro. And so I just kind of fell my way into epidemiology in kind of this weird, stumbling way, and graduated with a degree in global health and Spanish, and then went on to get my MPH in epidemiology. And then through the partnerships I formed with the faculty members here at San Antonio, I got a GRA position, and then from that came a full-time position. And through the job, I started doing analysis and realized I really liked it. And so it was kind of like this very faltering, like just kind of following what I'm interested in. There was no like plan in any way, but it worked out really well.
Thanks. I think that your journey is one that students can relate to, right? And when we ask that question, did you choose public health or did public health choose you? Most times it's public health chose the individual. And so one way or another, public health definitely chose you.
For sure.
So, you had mentioned a little bit about the work that you do now. I'd love for you to kind of share the work that you're doing. You are representing our community in action segment for this podcast. And so although you are also an alum, so we definitely want to hear that perspective, but like, what is the work that you are involved in, and how does that connect to you personally?
Yeah, of course. So, when I first started as a GRA in UTHealth, I was on a COVID grant because it was 2021. So that's what I feel like most of the grants were. And that's where I got my first taste of analysis. And that was in like writing manuscripts based off of the survey we were doing. And then I shifted from there to also an infectious disease grant. And that's one that I'm still currently on that's called Grassroots Health. And we are, unlike the previous one I was on, we're a service grant, not a research grant. So we provide the full continuum of care for hepatitis B and C. So that would be testing, treatment, vaccination, to low income or permanent supportive housing units here in San Antonio. And then there's also like a sister program in Houston, the original program. So I guess you could say we're the sister program. But that is one of the grants I do that I'm the program coordinator for. And so that's very, I mean, it's grassroots work. You going door to door, you're in the community. It's very kind of activism based and community based. And then the other grant that I'm currently on, which is very different, is a randomized controlled clinical trial for homelessness diversion, which I'm the database coordinator for, which means that I handle a lot of the logistics of the data flows from emergency departments, which is where we get our clients, to our program and how it's all interpreted and how it flows back and forth. And I found that very interesting as well, but certainly very different. But I have enjoyed the technicality of a clinical trial and having experience with that. So I'd say that especially suits my, like, the personal skills I want to develop. So I've integrated a lot of like Python scripts and coding, which I've found I really enjoy. And just kind of like understanding, like, I say big data, it's not a huge data set, but kind of the concepts behind it I found really interesting. And then with Grassroots Health, it's kind of a completely different ballgame, but also very fulfilling. That's more like forming personal relationships with people within the community, navigating them through, for some, as difficult times of their lives, like receiving treatment, and kind of understanding what it means to work like in underserved and, also rural communities, often with our grant as well.
Thank you so much for sharing that. It's rare that a person can like land in an opportunity that can like feed both sides of their like both personal and professional desires and skill. So that is really good. I will say that. Like just for you, 2 years out of a program, right? And you're still building your way through public health. I'm sure you're taking in a lot, and a lot of opportunities for you to continue to learn and grow on both sides. That's absolutely awesome to be able to see both sides. Very interested to know what excites you most about what you're doing in the work. You could just think of one thing.
Yeah. I think immediately I'm very excited by the potential with our homelessness diversion clinical trial. There's been like talking about like possibly implementing like language learning models and like AI into how homelessness diversion is performed. And that is super fascinating to me and something that I think is, I mean, AI is very new, right? But I think it's super, super interesting to see how we can incorporate that into public health. And I think it's the direction that the world is going, like you like it or not. And so I'm very, very excited to dive more into that and like develop my skill sets there and then come up with new ways that we can apply it to our programs. That's the first thing that comes to mind.
No, that's exciting, right? And I feel like I have not heard of the application of AI in that sense. And so I'm excited to see kind of where that goes. And, to Kim's earlier comment about just hearing your experiences, I think what's also very unique about your pathway is that you've landed a position where you're very much involved in data and analysis and data management, but then also you're on this other project that's very community oriented and focused and involves advocacy work. And I want to know, you've been on the student side, you're now on the graduate side and working for the school and working with students and supporting them too. Like, how can students get engaged in either of those areas if they find themselves interested?
Yeah, so for me, which granted, I started my MPH in fall of 2020, so maybe a bit of a unique experience compared to people starting now. But the GRA position that I had with Dr. Sai, who I still work under, who's still my supervisor, that was definitely like the crux of my experience. And he's been such an amazing like mentor and supervisor that he's allowed me to like come up with these ideas and like just kind of follow them, which I've been very grateful for. So certainly, like if you are at all interested in research or continuing in research, just finding a GRA position like that, which can be difficult, easier said than done, right? Because they're, you know, everyone wants them, I guess, in some cases. So also just like forming relationships with faculty, that's something that I struggled to do during when I was in an MPH because we were all remote. And so I had trouble kind of also with the way the school set up, that a lot of my faculty were in Houston. And I was like, it's not like I can walk into their office. But even as someone who's still on campus but not as a student, it's something that I've still been trying to like tell myself to do. And so I've just, you know, just like knock on their door, which sounds kind of silly, but I've even done that like this year. I've like put it as a goal and I'm like, you need to talk to some of these faculty members, and they have such amazing stories and they've offered such great advice. Particularly as I look at applying to like PhD programs in the future, they've been really able to help guide me in that way. And then just kind of like taking any opportunity that's given to you. So like just like following different paths, asking questions, just seeing what people have to offer. Because grassroots takes on a couple practicum students too, and that's kind of how we found all of them, is just someone who's just like, you know what, like, do you have space for me? Like, I want to do this. And we do. And I'm, you know, like to cater the experience to what they want. And so we have a student coming on actually in like a couple weeks who she was like, I want to get into analytics. It's really hard if you don't know analytics to get an analytics like position. And so we've just kind of formed it around her interests, and she wants to learn like Stata and Python and all this kind of stuff. So just really chasing down opportunities and forming those relationships.
No, that's really great advice. And thank you so much for working with our students and hosting them and being a preceptor. And you're probably one of the best preceptors for students because you've been on the student side before too. So it's like, you know what, I've been there and recently too. So I'm sure that you serve as a really great mentor for students. So thank you. You know, I wanted to hear a little bit more about the grassroots health initiative and specifically, you know, you had mentioned it's very community oriented as well as involves aspects of advocacy. And so I wanted to hear a little bit more about what that looks like, and especially where within the greater San Antonio area are you doing this work, and how does that vary? Because if you're doing it in Bexar County, parts of it are super urban and parts of it are super rural too. So I'd love to hear the differences that you've experienced there.
Of course. So just generally what our program looks like. So we're a partnership between the School of Public Health and the School of Nursing at UTESCA, which is UTHealth San Antonio. So that's been really interesting. So the nurses do all of the clinical side, the testing, the lab work, all that stuff, vaccination. And then our team at the School of Public Health is like a community health worker team. So we kind of serve as like facilitation, patient education, like that kind of thing, basically like logistics as well. And so we have been in San Antonio since August of 2022. And so we, since that time, have gone to probably close to 20 different low-income housing communities. So it's this apartment complex management company called Prospera. And so they tend to offer a lot more services than your average apartment complex. So the residents, I feel like, are kind of used to like health fairs, and like they have food bank like distributions pretty frequently and stuff like that. So it fits in well with the community. And the people we want to serve are people who may have had experiences with homelessness homelessness in the past. And so we just go in, and my CHW team will like go door to door, leave flyers, raise awareness, and then we offer tests. And then based on the results of those tests, we do navigation to vaccination or treatment, which would be very low cost or free often in most cases. And so we kind of try to help people through a full continuum of care and not just be like, well, here are your results, bye, you know. And so I think that's a really unique aspect of our program for one. And then most of our sites are in Bexar County because it's the most populous county. But we've also gone to other more rural counties outside of it. So we've gone to Caldwell County, which is where Luling lives. We've been to Guadalupe County, where Seguin is. And then we've been to Kamal, where we went to 2 different places in New Braunfels. So those are much smaller areas and a lot more rural. And it certainly was a lot more challenging to help navigate people because we were kind of used to relying on the Bexar County resources of having like large hospital systems and like CareLink, which is San Antonio's version of Houston's Gold Card, kind of. And then all of a sudden we went to these rural areas. We were like, oh, they can't get it. They're not Bexar County residents. They don't have a huge university hospital nearby. And so we kind of devised this unique like telehealth model, especially for treatment, which is the most complicated aspect, where we'll have a Bexar County hepatologist provide telehealth visits for people. And then our CHWs will go out and like assist them with navigation and anything. So that was a unique challenge for sure for the rural counties. But it's very interesting. We're expanding our sites to include more non-traditional sites. We're working with Corazon Ministries to provide testing for people who are actively homeless and like frequently come to day centers and stuff like that. And so hoping to reach, you know, an even more at need population and provide care.
So you would truly say the differences between the rural and the urban work that you do, like it underscores the gap in terms of their access
Definitely
to healthcare and services, right? But it sounds like a really good model that you guys are shifting towards with the telehealth and telehealth resources. I'm sure COVID played a large role in us thinking about like what telehealth resources we need to make sure we increase for certain communities, particular rural communities. I also am curious to know in terms of you shared earlier about, or we talked about your role as being a preceptor for our students. With you being a recent alumni, it's so funny. I just realized this year I'll be 10 years an alumni. So I guess I'm not as recent anymore. I'm like, oh, so it's my 10-year anniversary. But for people who are working, particularly the alumni from our school who are out in the field doing this work and maybe in rural health and maybe doing work in rural communities, could you share the importance of that mentorship that's necessary for the work that they're doing to bring our students along, and then to possibly, you know, connect with other alum in our network? Like, what would some words of encouragement or advice that you would give our alumni, particularly those working in rural health?
Yeah, I mean, certainly I think the connection and staying connected is just the key to all of it. Because especially with grassroots, it's been such a large effort to take on so much, because it's a complicated grant because there's so many different pieces to it that we're doing for historically a difficult to reach population. And so forming partnerships with different community organizations has been key. And some of those partnerships have been formed through alumni and just like knowing people from the school. And so like some of them, you know, we've met through like conferences and stuff, is that people just happen to be like, oh yeah, like I work at UTHealth too, and I do this, you know, professional education for hepatitis. And I was like, wait, we're doing something similar. And then we just formed this communication and relationship off of that, which has been really key. So just staying in contact and just, you know, following those knowledge. And I think especially for maybe like new alumni or even students who are forming those relationships too, is to like not be afraid to like email someone after like multiple years away from them too, because I think it is public health as a field, just it kind of fosters, I think, partnerships in that way. And a lot of the folks that I know would like be super happy to hear from someone after multiple years, you know, to especially if there's something that they could work on together. So, you know, I think that's also especially key for rural communities as the resources are less available. So to just make sure that you're utilizing everything that could possibly be available to you, because sometimes it's there and it's just really hard to find about. And so just communicating with people who are doing similar things and then just pooling your knowledge together, we found to be very effective.
What a great call to action too. So it sounds like too that you're open if others are out there doing similar work in similar communities, maybe not in Texas, but elsewhere, and they have great experience or stories to share or practices that are new and up and coming. You know, public health is such a small, it's a small world, but public health is also such a small field, and especially those that are working in more nuanced or smaller communities too, right? So
Absolutely.
We're all in it together.
Definitely.
Well, Abigail, I think that's all the questions we had for you today. Well, thank you so much for participating. Your feedback has been, or your experience has been truly wonderful to learn about and share. And I think our listeners will surely connect with it, especially our students that are looking to graduate and our recent alums too.
Awesome. Yeah, no, thank you so much for inviting me. No, I really appreciate the opportunity to speak about my experience. But yeah, if anyone's ever interested in the work I do or anything like that, like I think I've been communicating this the whole time, but like I love forming new relationships and partnerships. So I'm always open to anything. So yeah.
Awesome. Well, you all heard that. That's what this is all about. And so we look forward to the reach outs that you'll get and the students who are listening, right? Don't hesitate to send that email. If you've been disconnected for years, don't hesitate to follow up, stay connected. Thank you so much, Abigail, for your time.
Okay, welcome back to the Beyond Boundaries podcast, an action-led podcast at the School of Public Health, UT Houston. I am Kim Baker here with my co-host, Dr. Robert Hammerberg. We are so excited about today's episode. This is the final episode of our season 1, and so we're super excited to be focusing this conversation on efforts in rural health in our state. And we're joined by two guests of ours, two folks who are truly working in public health practice and will share their experience and their insight on the role of rural health. And so we're excited to be joined by Ms. Brandii Grant and Ms. Savannah Walker. We're gonna ask a couple questions like we normally do, just to kind of get it started and get to know a little bit more about themselves and why they stepped into public health. And so our very first question, we start this question off all of season 1. And so this episode is no different. And so we'll start with you, Brandii. Tell me, did you choose public health or did public health choose you?
I had to really think about this one. Did it choose me or did I choose it? I guess in a way, I chose public health. So I was a biology undergraduate major at Clark Atlanta University. You know, my mom was in science, so she always told me you have to go into science or math. She didn't really give me very many options. And I spent years just doing laboratory work and research and you know, it really wasn't for me. By the time I got to probably my senior year of undergrad, I was like, what am I going to do? I didn't want to go into medicine and become a doctor. I wasn't interested in nursing school. And literally, I was in my advisor's office, and there was a poster on the wall that said, things you can do with a biology degree. And it had probably 100 different, you know, 1 or 2 word phrases on it. And I was kind of like reading through it, and I saw something called public health. You know, I'd never heard of it before, ever. And this was me, I guess, probably 19, 20 years old, undergrad. And so we didn't have Google then. That was like 20 years ago. So there was no Google, but I got on the computer And I looked it up on some search engine, and I thought, wow, this is really interesting. I think this could be something I'd like to do. And so I started to learn and do a little bit more research. I think at that time I may have taken one class over at Morehouse in a public health type of topic. That particular class, they were working on their School of Public Health. And I loved it. I thought this is a way to stay in health and impact populations. And so that's what I did. I started looking for schools, probably not too much long after that, and applying for graduate school. And of course, I'm an alum of UT, School of Public Health, Houston. So I guess it chose it. Did it choose me? I don't know. But it's been fantastic. It's been a great ride.
Thank you for that story. It's so funny that you mentioned like 20 years ago, the search engines, and what automatically popped into my head was like Yahoo. I remember like Ask Jeeves.
Yes.
Y'all remember Ask Jeeves?
Yeah.
So I remember like those early search engines doing that search for public health as well. Like, what is public health? So yours definitely sound like it might have been both and, right? It was kind of like the poster was like talking to you, like,
yes,
here I am, while you were also seeking.
Exactly. Because I was, preparing for graduation, and I didn't know what I was going to do and how I was going to explain to my mom, I don't want to go to medical school. I don't want to do research. So it really saved me. It really did.
Thank you for that. What about you, Savannah? Did you choose public health, or did public health choose you?
That is a great question. Well, my career path started a little later in life. My child was bullied in daycare, and as a result of being bullied, yes, ma'am, a child pushed him down on the ground and chipped his 2 front teeth. Yes. And later in life, it caused spacing, and he didn't like to smile. So later he went to the dentist, and he had ortho treatment, and he began smiling again. And it made me as a parent feel good because my child was smiling. So I said, I want to give kids that same opportunity to smile and feel good and confident about themselves. So I want to go in the dental field. So I decided to pursue my education in dental hygiene. After I graduated, you guys, I said, well, what am I going to do? I started working in the private sector, and one of my coworkers told me about Texas Mission of Mercy. Now, have you guys heard about Texas Mission of Mercy? No? It's a nonprofit organization that goes around and provides dental services, free dental services. I'm talking about exams, screenings, cleanings for free, prescriptions. But these people wait in line 10 to 12 hours just to receive these services. Now, in 2018, they popped it right here in El Paso. So I said, you know what? I want to experience this. So I volunteered, and it was a humbling experience, and it opened a gateway for me to public health.
Thank you for sharing that. Yeah. So like that service, like, and it also sounds like it might have choose you through your son, like gravitated you into that career path, and then that experience of that service, right?
Yes.
And that kind of people focus, right? That's very public health. So thank you for sharing that.
Yeah, what I love about your answers too, and it's very poignant for it being the last episode too, is I feel like most times our interviewees say that public health chose them. And so to hear the flip side, or like the and, where no, I played a role in choosing this too. I feel like that's been a very refreshing viewpoint. So I thank you both for sharing your stories. I'd love to learn a little bit more about the work that you all do. You both work for the Texas Department of State Health Services. You both work in regions that are on opposite sides of this giant state of Texas. Brandii, you're in 5-6 South, which covers the Houston, Galveston area, as well as up towards the northeast. And then Savannah, you are in region 910, which covers West Texas and El Paso. And so I'm so curious to hear about the kind of the work that you all do in your respective areas. And then I'd also love to learn a little bit about your experience working within your regions that both have large metropolitan service areas, as well as lots of rural areas. and kind of what your experience with working in those rural populations are, and how is that different from the work that you all do in the urban centers. And so, Brandii, if you could start, that'd be great.
Sure. So currently I'm a program manager. I manage the Community Health Services Program at 65 South, and our region is a 16 county region. Of course, we've got Houston, smack dab in the middle, so it's a largely populous region. We don't have as many counties as some of the other regions do, but we have a large population, and it's growing, especially in our northern areas, our Liberty County area, um, I was trying to think of Brazoria County, Galveston. We have a lot of counties that are just growing exponentially, really. So we're really watching that population grow. So in my community health services program, we do a lot of things. We're kind of sort of a Jack or Jill of all trades. So some of the work that we're doing is tobacco prevention. So we have a person on our staff that works tobacco prevention, providing education. And he's just begun to launch an ECHO project, which is similar to telemedicine, but the audience is for professionals. And so that's a really exciting project. We have an oral health team. So I was thinking about Savannah, which you were mentioning. We have a dentist and a dental hygienist on our team. They travel our region and Region 7, of over 40 county region, to provide oral health services to elementary kids. And for some of those children, that's the only oral health they get all year. So we have a contract with school districts, and that dentist and dental hygienist, they do a fantastic job providing care and providing fluoride varnish. They're also collecting a little bit of data that they share about caries and cavities. We also have a team of public health nurses in those rural counties. There's a nurse and a community health worker in those, and they're in clinics, rural clinics. In those clinics, they do TB case management. That's something people don't think about often. Tuberculosis, we still have a large amount of tuberculosis in our counties in this area. So they do case management and they provide treatment. They also do STD prevention, primarily treatment to cases. And then the biggest thing is maternal child health that we do. So our maternal child health work is breastfeeding work. Those nurses are lactation certified, so they can provide, care to families, really. We also work on creating lactation spaces for families and for people to express breast milk. We do a lot of work with injury prevention, providing car seat education and the distribution of car seats. And we also are working really hard on a prenatal education curriculum. That's been in flux for quite a while, but so we're kind of doing quite a few things. And I would say on the rural side of things, as a public health agency, a state agency, we really are filling in the gap. So we don't provide comprehensive care in our clinics. We just have a nurse and a community health worker there, but we provide care for people who are uninsured or underinsured. So we kind of are a catch-all for the folks that fall in between the gaps. But, our goal would be to get people into comprehensive care or to get them onto of course, health insurance or Medicaid if possible. And sometimes that's possible and sometimes that's not. And so I think for us, it's just making sure the community knows that we're available and we're a resource. We're a state agency, so we run on taxpayer dollars. And so we are their public health entity in those counties. A lot of our rural counties don't have public health departments. You think of Houston or Harris County, both of which have large, very functional, highly functional health departments, but a lot of our rural communities don't. And so that's where the state health department steps in and picks up public health services. So I guess that's probably the biggest difference. And of course, in rural communities, there's not much transportation. And I would say there's very few providers in our rural communities. Some of our counties don't have any OBGYNs. Some of them don't have any hospitals. And so community members have to drive for miles to get care and treatment. So, there's some things we can do in our clinics, but if, someone's giving birth or they need more care besides a flu shot, something to that effect, we really have to send them to large major metro areas. So I would say that's probably the biggest difference in public health in our rural communities versus in major urban areas.
Awesome. Thank you, Brandii. I have some questions, but I'll follow up with you after we hear a little bit from Savannah.
That was amazing, Brandii. Um, so I'm a regional dental hygienist for my region in El Paso. So our goal is to reduce the proportion of children with untreated decay in vulnerable and underserved populations. We educate children, we inform parents, we collect oral health data, we promote oral health through leadership and public health practices, policy development, education, and population-based preventive services. We provide preventive dental services in the schools. So we're Smiles in Schools program. We go to the school, we set up in a classroom, a library, an auditorium, a closet, it doesn't matter. We want to provide preventive dental services. Now, the services that we provide are limited oral evaluation or screening. We provide fluoride varnish, which helps remineralize the tooth structure and strengthen it. We will provide a sealant, which seals the tooth and prevents cavities to every tooth that is sealable. Now, that's 16 teeth that can be sealed for free. All the parent has to do is consent to treatment. It's that simple. Okay, and we focus we provide services in counties with a high professional dental shortage area. So we look at the counties whose score is 15 or higher, and we provide services to those counties. Now, the score ranges from 1 to 26. We're looking for counties who fit in that 15 or higher level. That's all of West Texas, okay? Our job requires extensive traveling. Now, when I say extensive traveling, we travel from El Paso to Mason, Texas. Mason, Texas is 469 miles away from El Paso. We drive in a dental van with our dental equipment. We're a one-stop shop. We have everything with us. And while we're out in the field, we spend 3 to 4 days out in the field so we can provide services to different schools to make it worthwhile to people in that area.
Savannah, thank you so much. That is amazing work that you all are doing.
Robert, you say amazing. You should come visit us when we go to Candelaria. It is such a rewarding experience. Candelaria is about an hour and a half away from Presidio. So to get to Candelaria, you travel down this wily road up and down the hills. You have no cell phone reception. They may be about 55 families there. It's a very small community. And they have no access to care.
Wow.
So, yes, Office of Border Public Health, they do an amazing job of hosting this event. And we all come together and we provide services.
Wow. Savannah, I'd love to hear a little bit more about the Smiles in Schools program and who all is involved in that program, and are there opportunities for students that are interested in rural public health to maybe work on projects or things of that nature in support of that project, which seems so impactful?
So our Smiles in Schools project, we reach out to the independent school districts and we execute a memorandum of understanding. It's a contract between us and the school, and which allows us to provide services for up to 5 years to any school within an ISD area. We would love for some of the dentists at Texas Tech to come and shadow and help and assist with paperwork, or if they bring an instructor with them, maybe there's a possibility of doing some screenings with us and applying fluoride varnish. However, they would need an instructor with them in order to help and assist provide services. But we always welcome people to assist and help us.
That is fascinating. Robert, I know you want to follow up with Brandii, but I'm already thinking of like opportunities for some of our dental and MPA students to like go out and take trips and do things, that could be possible, like the possibilities. And so thank you for
endless.
that. Yeah.
And I also like to mention that We shall be getting a dentist soon. So they have that possibility of shadowing with our dentist, which is a phenomenal experience in itself. And just traveling with us to these schools and watch us provide these services while we're collecting data is beneficial. Just to get your feet wet just a little bit.
No, that's great. Yes, I've got so many gears turning right now. But Brandii, I'd love to, similar question to you. I'd love to hear a little bit more about the ECHO project, and same question about like, what is all that involved in that project, and where are there opportunities for, because it seems like it's very unique, right? It's focused on the provider education. And so I'm curious to hear about opportunities too for students to get involved in that kind of work and learn more about it.
Yes, absolutely. So our regional medical director, his name is Dr. Carlos Placencia. He kind of got us on this path, this path to work on an ECHO project. Now this comes out of, I believe it's the University of Nebraska. I hope I'm getting that right. And it basically is a project that we have decided to focus on tobacco. And we chose to focus on what we call the counties in 5 South, which is our Hardin, Jefferson, Beaumont area. And we sometimes will kind of push Chambers County into that group as well, because they're all in that sort of same area of the region. And that was our area in our region that had the highest rates of tobacco consumption. Mm-hmm. And of course, now I say tobacco consumption, but we all know that right now vaping is one of our biggest issues and concerns. So we're not only looking at tobacco consumption in and of itself, but we're also looking at rates of vaping, which we know are really high among middle and high school age, all ages, but they're really increasing among middle and high school age students. So that was our highest area, and we decided that's where we would focus our project. And so it's led by Julian Lauday, Dr. Julian Lauday, and he's also co-leading it with Dane Bossert. What we've done is begun to work with community leaders in that area, the health department leaders, and anyone who has an interest in reducing the rates of tobacco in 5 South. And so they've created what we call an ECHO hub. And that's basically an advisory group. They help us to identify case scenarios that we can listen to. So the echoes are once a month. They're on Microsoft Teams, or they just need to be on some sort of platform that's TELUS. So we're using Microsoft Teams. And basically what we do in those sessions is we do an educational component, and then we also do a case study. So we're always looking, here's an opportunity for involvement. We're always looking for case studies to take a look at and learn from. So in addition to that, the educational piece and the educational component. So right now, some of what we're doing, for example, is we might have a case study of a school or a school district that was able to reduce their consumption amongst teens with vaping, or maybe they have an issue that they want to talk about amongst the group. Now, the audience for those sessions is always providers. It can be, and when I say providers, it can be community members, school nurses, school principals, anyone that has an interest in working on reducing rates of tobacco or e-cigarette or vaping. And so we do those once a month. We've just gotten it off the ground. We're only about 2 months in. It's taken almost a year of planning and preparation. But our goal for the project really is to see rates of tobacco and vaping to be reduced in 5 South. So I would say for students, you're always welcome to be a part of it. You could probably even be a part of the advisory group, or if you just want to come and learn and see how it works. There are ECHOs really worldwide. I've found them in other countries, and other health departments do them on various topics. Maternal health ECHOs, there's ECHOs on all sorts of things. And the original program was a doctor that was working on hepatitis that unfortunately was unable to help a young lady who passed away. And if he had been able to connect with that young lady's doctor, he could have saved her life. And so he developed ECHO to try to figure out a way to share information broadly amongst providers that could help to be really life-saving. And so he's created the ECHO project and expanded it. I was going to say nationally, but it is actually across the world now, and we've just begun to work on it. So we're still in its infancy stages. We're learning about it, and we're trying to keep everything, going and get everything off the ground. But we're very, very excited about it. And it's the first we've done at DSHS too. So that's another thing. So really a team of people I'm a support person on that project. I don't lead that project, but I'm really excited about the work that's being done on it.
Wow, that's amazing. Really innovative. That's cool that this is a new path for DSHS to try out. Thank you so much for sharing information about the ECHO program framework. I'm unfamiliar with it, but that's something that I definitely want to look into. And I appreciate you sharing details about this because it seems like it's a very community-based approach to coalition building around topics of importance. And it seems like it's very applicable to multiple different areas of health. And I know that we have students and I know that we have faculty that are interested in tobacco utilization and its impact on health outcomes. You know, you mentioned those case studies. I'm sure that there are students who are like, hey, that'd be a really great practicum opportunity, or I could use that for my ILE, or even faculty who are doing research that might be good participants on that advisory council. So really great information, Brandii. I really appreciate you sharing that.
Awesome. And you guys have already shared so many opportunities that students can find themselves getting involved in. And so we look forward to kind of putting a bow on that and making sure that students know how to connect and get in there. As Robert says, use this for their practicum for sure. We want to, I know we're kind of getting close to time, but we want to kind of end it on a question that we asked our guests in the first season, just about your opinion on just kind of what do you think it will continue to take to help transform public health? And maybe we talk about it in the rural areas, right? Like, what is it that we still need more of, or kind of what is that one thing we wish we could do more of? Robert, you want to add something there?
Yeah, can I add to that point? What do you think too is like the biggest misnomer about working with rural communities in public health that people don't normally think about because they're not either living in rural communities or do work in rural communities? Whoever would like to take that.
I think that the misconception is that there is access to care. Like I stated before, I have to travel up to 469 miles just to provide preventive dental services. These people do not have access to care. Then the dentist that they could visit is about a 3-hour drive. So that means you have to drive 3 hours, wait about an hour and a half at the dental office, then get services, then drive 3 more hours just to get back home. So you're missing a day's worth of work. Now we're talking about people in a rural area. You can't afford, or you're not allotted that opportunity to miss days of work. So we're bridging that gap by providing preventive dental services to children who don't have a dental home. They may have never been to a dentist or seen a dental hygienist before in their lives. So we're that first connection between that child and the dental field. So that's why we want them to have a positive experience, you guys, which leads me to our baby shark. I don't know if you can see our baby shark. So baby shark is a tool that we utilize to teach the children how to brush and floss their teeth correctly. So we demonstrate to the kids the correct way to brush and floss. And then the kids, they turn around and they show us how to brush and floss the teeth. This is an amazing tool. It makes the children more relaxed. And by the time we're finished singing a Baby Shark song and they're demonstrating how to brush and floss, they are so ready to see the dentist and open up wide so we can get our limited oral exams. And then we tell them that, I said, well, you know, we can paint magical superheroes on your teeth. However, you can't see these superheroes, but they're doing work on your teeth, okay? And they're like, oh my God. And I was like, so you have to whisper in my ear what you want me to paint, okay? And this fluoride, it tastes like bubble gum. Do you guys like bubble gum? And at that time, they're ready to open up wide. Everybody wants to taste the bubble gum. We're helping remineralize the tooth structure. Everything is just going wonderful as planned.
Awesome. Thank you. What about you, Brandii? What would you say is the biggest misconception, or what do rural areas need more of?
I'm gonna use that Baby Shark, Savannah. I have an 11-year-old. I have an 11-year-old, but that might work with
It's
him.
too cute.
Brandii,
Yeah.
I want you to know that the oral health improvement programs, we have CEs for community health workers. I'm sorry I had to throw this spew out there because I have a video on there demonstrating how to brush and floss. It was on the Grit Awards. However, we have a video demonstrating how to brush and floss. Now, we also offer CE courses within our program. And if you take these CE courses, they will send you a puppet so you can demonstrate to people in your community health workers, nurses, the correct way to brush and floss.
Oh, that's fantastic.
Yes, ma'am.
That is too cool.
And I guess I would say misnomer. I agree, of course, with Savannah about the lack of services and access. And I guess I would just say that folks in rural community are amazing, and they live in rural communities because they want to live in rural communities. Many of them have been there for years and generations, and it's peaceful, and they don't want to live in major metros. They don't want the traffic, the pollution. I mean, there's a lot of reasons, I think, why people choose to live in rural communities. I certainly have lots of family members that do. So I guess I would say, some of us like the hustle and bustle of the city, but there's lots of people that enjoy the peace. I would describe it as peace and calm of our rural community. So, maybe the misnomer is just that they're there because they don't have any other place. But I think lots of rural community members love their communities, and it's really a matter of getting our services to them and meeting people where they are. We always say that in public health, you have to meet people where they are. Transportation is an issue, but they don't want metro buses and I don't know, light rails and those sorts of things. It's just really, I think, about adapting public health and the work that we do to fit into a community that they so love, and really working with people so that they can get the services that they need, but just in a different way than folks in the urban or metro places can get to doctors and stuff. So, I guess I would just say that's a challenge. But it's probably maybe a little bit of a misnomer there. And some of those communities are so beautiful. I don't travel as far as Savannah when I go out. I know our dental hygienists and dentists do, but I love visiting some of our counties. Like my travel from Belleville, Texas to Hempstead or to Columbus, it's so beautiful. And just the pastures, and there's so much beauty and green in those rural communities and in Texas. And sometimes I'm glad to get out of the city, when I get a chance to get out there and visit. So I guess that's kind of what I would say, and really just enjoying those areas and figuring out how to get public health services to those people.
Thank y'all so much. This has really been just inspiring, honestly, the work that you all are doing in terms of ensuring that we are meeting folks where they're at, right? This is public health. This is truly beyond boundaries. We're not bounded by, city limits and those geographies. And the work that you both are doing shows that and pushing past those boundaries. So thank y'all for that. And thank y'all for joining the podcast today.
Thank you for having us. It's been fantastic. So exciting.
Thank you so much. This was an amazing experience. My first podcast experience.
Hey.
That's great.
Yes.
Thank you both so much for helping us wrap up our first season, of the podcast. I think we're ending on a really great note.
Yes.
What I've appreciated is hearing the passion that you both have for the work that's being done, and just really shedding a light on the impacts that DSHS is trying to make within the realm of delivering services to public or to rural health communities and so forth. So thank you both so much for joining us.
Thank you.
Thank you.